Burns First Aid. In this video, we will learn about burns and how to treat them. In order to understand what is a burn, first we must learn the structure of our skin. The skin is a barrier between the inside of our body and the external environment, and it has many roles. Prevent penetration of pathogens. Prevent water loss and dehydration. Maintaining body heat. Reception of information from the environment through the sense of touch. The skin structure is divided into 3 layers. Epidermis, the top layer. This layer is up to 5 millimeters thick and it has no blood vessels or nerves in it. Dermis, located below the epidermis. The dermis contains the nerves that allow us to feel senses like heat, cold, pain, and touch. It also contains sweat glands, hair follicles, blood vessels that provide nourishment to the skin, and the sebaceous glands that release an oily liquid that covers the skin. Subcutis, the third and bottom layer. It is the body fat layer. This layer connects the skin to the body tissues below it and keeps the body's heat. The thickness of this layer can vary from a few millimeters on a lean person to many centimeters on a fat person. It is important to know the different skin layers because the severity degree of a burn is affected by the depth of the damaged skin layer. What is a burn? A burn is an injury of the skin as a result of exposure to high or low temperature, radiation, electricity, or chemicals. When the skin is exposed to these factors, a destruction of proteins occurs and fluids escape from the cells. The skin plays an important role in keeping the body heat and preventing penetration of pathogens. Therefore, a major burn will put us in risk of infection and hypothermia. Burn severity classification. A burn severity can be classified to 3 levels. Level 1. Damage only to the top skin layer, the dermis. For example, a sunburn. Signs: red and warm skin, mild pain, sensitivity to touch. Treatment: wash with cold water. Rehabilitation in a few days. Level 2. Damage of deeper skin layers. Dermis, the second skin layer. Signs: blisters and all the symptoms of level 1 burn. Treatment: same as in level 1 burn. Do not pop the blisters. Rehabilitation in 2 or 3 weeks. Level 3. A deep injury of all 3 layers all the way to the subcutis. Signs: no pain in the burn area due to nerve destruction, but with pain around it. Burned smell, black and peeled skin. Treatment: wash with sterile liquid, apply sterile dressing, urgently evacuate to a hospital. Threats: loss of fluids, infection, tissue destruction, hypothermia, a scab that will become a natural tourniquet or will cause difficulty in breathing in case it is placed on the chest. Edemas in the respiratory system. Rehabilitation after a long period of time. Sometimes skin transplantation is needed. Frostbite. Damage of the skin tissue as a result of exposure to extreme cold. Usually appears in body parts that are distant from the heart and exposed, such as the ends of limbs and the face. A frostbite can be superficial or deep. Signs: cold, severe pain or numbness in the affected area. The damaged area will be pale and can later turn black and develop blisters. Treatment: heat the injured area using only indirect heat. For example, air conditioner, clothes or blankets, but not hot water or a heater. Do not try to heat the injured area by rubbing it. Frostbite can cause irreversible damage. They should not be underestimated, and they should be treated promptly and according to the instructions. The injured person should be brought to a hospital urgently. Calculation of the burn area. One way to calculate the area of the burn is the rule of 9s that divides the body to areas that each of them makes 9% of the total body area. head, chest, abdomen, each hand separately, upper back, lower back, each thigh, each calf and foot. The groin area is calculated separately and considered as 1% of the total body area. Remember, always remove the patient from the danger area or from dangerous factors. Before approaching a patient suffering from electrical injury, make sure that the electrical source is shut down or remove the injured person from the electricity source using an object that does not conduct electricity. Remove clothes and jewelry from the injured person, but only if it's possible and they are not stuck, due to a threat of the body tissue swelling towards them and creating a natural tourniquet. Burns on the throat, face, or chest raise suspicion of burns in the respiratory system that might block the airway and cause choking.